Cardiovascular disease is a very serious problem in our country. So what can you do to be aware of this disease and to take steps to prevent it? Dr. Bruce Clark from the Center for Functional Medicine joins us today to talk more about it. Let's talk first and define cardiovascular disease. What exactly does that mean?
Well, a basic definition would be a disease of the blood vessels and heart. Basically, kind of refers to atherosclerosis, which is narrowing or a building of a plaque in the vessel. This narrowing can cause blood supply issues to body organs, especially the heart or brain. That can lead to stroke or heart attack. It's a very serious problem. There's roughly 36% of the deaths in America occur from cardiovascular disease. That's heart attacks, strokes, and heart failure.
And when you think about it, we have like, what, 60,000 miles of arteries and blood vessels and things like that in our body.
There's a lot of information.
I mean, everything kind of has to work pretty well for us to stay healthy. And when you start adding these sorts of elements, it starts to complicate things pretty incredibly.
Exactly. And lots of things can affect that. But the cost of this disease is huge. It's hundreds of millions of dollars a year in healthcare costs, so we have to get a handle on it. The good news is that 80% of this can be preventable, and that's just with optimizing nutrition and exercise, getting to an ideal body weight and fat percentage in your body, and quitting smoking and limiting alcohol consumption.
Easy things that we can all do, right? So how does functional medicine then approach cardiovascular disease as opposed to coming in on the back end of it and trying to treat it once it's already happening? Again, this is an idea of being proactive, right?
Exactly. So we want to talk about lifestyle, what the patient's doing. So that's the first step that we talk about. There's lots of risk factors involved in cardiovascular disease. There's over 400 known risk factors that can affect cardiovascular health. There's 5 huge ones, which are the most common, which would be diabetes, hypertension, lipid issues, which is cholesterol and the things that carry cholesterol around, these lipoproteins, obesity, and smoking. Those are all the major factors.
There are some other ones sort of on the periphery: kidney disease, nutrient deficiencies, things like that, sleep, stress, all of those things, like we said, go into impacting cardiovascular disease. So where can we start? And like, if we're going that functional medicine approach, where can we start and what do we need to do with you guys?
Well, the first thing would be some lab assessments, taking a thorough history, obviously, and talking about what you do day to day with lifestyle, nutrition, exercise, activity, stress. But then we're going to start talking about assessments. So that's blood pressure measurements, that's your weight, that's your BMI, your body mass index. These are basic things that we can do. And then you can do laboratory testing. So there's lipid panels that look at your total cholesterol and LDL and HDL, also chemistries to look at your sugar and your kidney function. But we can go much deeper than that. You can look at deeper markers of health, inflammation markers, oxidative markers. You can do hip-waist ratios. You can do 24-hour blood pressure monitoring, many things.
So if you're looking at these markers, if you're finding this information, there are ways to, what to focus on to prevent it on the front end.
Exactly. So then we're going to just use, nutrition and exercise as a leveraging tool to help patients get better and improve their health. We might use prescription medications, obviously, and then we might use supplementation as well to improve function.
I mean, it seems like a logical thing to do, to kind of get on the front end of it. Start early, figure things out, and get well before you get sick, right?
It's basic prevention.
I like it. Well, Doctor, it's very interesting to talk about, and if you want more information about functional medicine and their approach to cardiovascular health, give them a shout. Check out their website. Lots of information there. Thank you for being here today. Stick around. When you have a tailored suit, you're going to look good and you're going to feel confident. Details on a made-to-measure